Hi, everybody. We're so happy to have you on today's US Reps webinar, Accreditation Matters, Preparing Future Leaders in Exercise Science. Today, we're going to be talking about programmatic accreditation and how it plays a vital role in ensuring the quality and effectiveness of academic programs in exercise sciences. Today, we have representatives from the Committee on Accreditation for Exercise Science, the Commission on Accreditation of Strength and Conditioning Education, and the Commission on Accreditation of Athletic Training Education to describe how they're an integral part of preparing students for the workforce in exercise sciences. Graduates of these accredited programs are better equipped for certification and job opportunities, making accreditation a key factor in career readiness and success. We're going to be exploring a number of topics today: programmatic accreditation, the benefits to students and institutions, and providing guidance on the accreditation process. Today's esteemed panelists are going to be Dr. Colin Wilburn, Dr. Keisha Harrell, and Dr. Ben Thompson. And my name is Francis Narek. I'm the current president of the U.S. Registry of Exercise Professionals, and I'll be facilitating today's discussion. So we'll start with Colin. Could you provide us a brief introduction?
Sure. Excited to be here. My name is Colin Wilburn. I'm at the University of Mary Hardin-Baylor in Belton, Texas. I serve as the Executive Dean for the College of Health Sciences and the Associate Provost. And I am the chair of the CASCI, which is the accrediting body for strength and conditioning.
And Keisha, please.
Hello, everyone. I am a clinical professor in the Department of Kinesiology and Sports Sciences at the University of Miami, where I also serve as an associate dean. I'm here as a representative of the Commission on Accreditation of Athletic Training Education, where I serve as the vice president to the Board of Commissioners.
And Ben.
Right. Thank you, Francis. So I'm Ben Thompson. I am a program director of an accredited exercise science program at Metropolitan State University of Denver. And I've been here for about 15 years. And currently, I am the chair of the Committee on Accreditation for the Exercise Sciences. I've been in that role for approximately 6 years and a total of 9 years about with the COAES.
Wonderful. Just as a couple of housekeeping notes, just as I forgot to mention at the top, this webinar is recorded and we'll be sending it out after the recording of the webinar. And then secondly, be sure to ask your questions to our panelists today. We're going to be answering those in the last 15 minutes or so. We'd love to hear your feedback and questions that for everyone to discuss. So this is really kind of a question to all the panelists. When you're talking about your respective accrediting bodies, how do you ensure the quality of academic programs are in the exercise sciences? And so let's start with Dr. Harrell first, since she has the most tenure with Katie's.
Sure, great. To talk about how Katie, and I'll remind you, we call it Katie for short because sometimes I go through a whole program and someone asks, who is that Katie person you were referring to? So Katie for short. And so yes, ensuring quality of academic programs is basically what the Katie does. The Commission on Accreditation for Athletic Training Education, our main job is that we are a professional accreditor that specifically accredits athletic training programs, a specific healthcare field, a little different maybe than some of the exercise science accreditors on here. We're a healthcare program. And so we accredited currently professional programs, post-professional programs, as well as residencies and fellowships. And anyone in the United States who wants to sit for our board of certification exam must graduate from a CATIE accredited program. And so to answer your question, assuring quality of academic programs is really what we do as an accreditor. Our job is really to make sure that we're providing quality education, or we're making sure that we review the quality of higher education institutions and making sure that they provide quality education.
Can I ask one follow-up question to that? I guess sometimes it's helpful for faculty and leaders, certainly of exercise science programs. Is there a difference between programmatic accreditation and institutional accreditation? And could you kind of, I guess, maybe explore that a little bit?
Yeah, I think if you think about institutional accreditation, You think about accreditation that has a very specific cause. Some of our regional accreditors, they're very broad in nature. Our professional accreditors, specifically with athletic training, is really looking at the quality of one academic program versus many. And so for Katie, we're a programmatic accreditor that really ensures that we're providing quality athletic training education.
Great. Colin and Ben.
Sure, I will agree with what Dr. Harrell said. In fact, Katie was largely the model that we aspired to as we created the CASCI. They did a fantastic job of elevating athletic training as a career, as a profession, and did that in a way systematically over the last 2 decades. And so yeah, I mean our role is to raise the bar of education and the expectation for an entry-level practitioner in the field. And so that's one of the things, or that is not one of the things, that is what we do, is set the standards and ensure that programs are meeting those standards so that we know as someone in the future after 2030 to sit for the Certified Strength and Conditioning Specialist exam, you will have to graduate from an accredited program. And that way we're ensuring that there is any employer, anyone who's hiring somebody with that credential will know what their minimum level of expectation is for an entry-level practitioner. And so our job is to ensure that the education that they're receiving meets those standards.
Great. Ben?
Yeah, no, thank you, Francis. So, the COAS is very similar to the other 2 accrediting bodies to some extent. So it's often confusing, especially to newer programs. So in reality, the accrediting body for us is the Commission on Accreditation of Allied Health Education Programs, or CAEP. Actually, athletic training was under the CAEP umbrella initially until they moved on to become their own accrediting body. But really what CAEP is a programmatic post-secondary accrediting agency that's recognized by the Council for Higher Education Accreditation. It's one of the largest programmatic accreditors of health sciences for profession educations, and the COAS is a member of CAEP. And what our role is we're responsible for reviewing programs, self-studies, coordinating site visits, all this stuff to eventually formulate accreditation recommendations. And we send our recommendations to the CAEP Board of Directors, and it's them that actually make the ultimate decision. So the COAS kind of makes our recommendations. We're a non-biased kind of professional, specific peer-reviewed committee that looks at kind of helping programs and continuous program improvement. We're a little bit different than some of the other accreditors in that we are an outcomes-based accreditation model. Other accrediting bodies have a process base, and ultimately we're all looking for an outcome, and that's providing education for students that graduate. So looking at graduation rates and pass rates and things like that. But a process-based program or model tells a program how to reach a specific outcome, whereas the outcome model that CAEP and COAS uses is we want to see what that final outcome, for example, like student retention or graduation rate or something like that. We want to see that outcome, and how a program reaches that outcome is really up to them. So our view is that kind of as long as a program meets our required competencies and is receiving support it needs from the institution, it can run its program pretty however it wants. And we've found that this flexibility, allowing programs to retain their uniqueness, is very open to faculty. They really enjoy kind of how they do this. Our structure is we're comprised of 7 sponsoring organizations instead of just 1. So we're comprised of the American College of Sports Medicine, American Council on Exercise, American Kinesiotherapy Association, American Red Cross, Collegiate Strength and Conditioning Coaches Association, the National Academy of Sports Medicine, and the National Council on Strength and Fitness, as well as 3 at-large members that represent faculty. And all these individuals come together to create our standards. So it represents to some extent maybe a larger portion of the exercise profession. And we just similar to Katie accredit at different levels. So we have our personal fitness training, which is an associate's, the exercise science, which is a bachelor's degree, and then exercise physiology, which is a master's degree.
So the question goes to the full panel is, why do you think programmatic accreditation is crucial for students preparing for specific jobs in the exercise sciences? And I'll be open to anybody to answer that one.
I can start. I think it's just really important. You know, the word that's come up over and over again is quality. I think when students go to and they know they're going to an accredited program, they know they're going to get that stamp of quality. It's a way, a method of validating a program. It's a way of protecting the program and students knowing that they're going to get a certain standard of education. But I also think it's a way not only for students to evaluate a program, but for students' futures employers, and it even benefits the patients because the patients are going to get care that was standardized across the board. So to me, it's really about the quality and it's really about the validation.
Yeah, and I'll add one of the things that was important to us prior to the creation of CASCI. Anyone could come from any degree path and sit for and take the exam. And while that's great, they pass the exam, we have no way of knowing, an employer has no way of knowing, do they have actual experience? Were they trained in field work? And so that was a big part of the push to move to accreditation for us, was to ensure that our students and people getting out and graduating have actual hands-on experience and have been assessed at their level of competency in hands-on experience.
Yeah, no,
I'm sorry.
Sorry, Keisha.
Oh, no, I just was going to add one more thing. You know, we talk about the benefit for the student and ultimately the benefit for the patient, but I don't think we talk much about the benefit for the organization, the institution that's being accredited. And Katie's made a really big push to change the culture to make sure that we're really partnering with institutions. So when someone has an accreditation for Katie, they know they're going to get resources, they know they're going to have support, and really a framework and a structure to move forward from. And just like Ben said, the Katie really, with our accredited programs, we're not prescriptive. We're also outcomes-based versus process-based, and we allow institutions a lot of autonomy, but knowing institutions knowing that they have an organization that they could turn to for support and resources, I think is a huge benefit.
Yep. No, I was just going to echo that's same thing with the COA. We're just really there so employers have an understanding of what they're getting. It levels the playing field. So a strength and conditioning employer knows what that student or what that employee, what their knowledge and skills are. Same thing with exercise science.
So I guess the question now is just like when we're thinking about how industries change over time. I know that there's a lot of things we're looking at exercise and the integral role that it plays in the health and well-being of clients and patients, things like that. That's certainly been a change that we've seen in the last like 5 to 10 years. How have accreditation standards kept pace with the changes in the industry?
Yeah, I can just briefly talk a little bit about that. So I know how CAHEP accreditation and the COAS works is, we create these recognized standards, and CAHEP, since they accredit different professions, so there's certain common elements within these standards, but there's also discipline-specific requirements for training to entry-level practitioners in that profession. The standard review process is very rigorous. We get input from communities of interest, so that's employers, students, faculty, everybody. There's a public open hearing process, and then ultimately we, as the COA, also have to approve the new standards as well as our sponsoring organizations. So that's how the general kind of standards are created. But I think at the programmatic level, an important part for programs is they have advisory boards, and those advisory boards are the ones that are really, currently working in the field, and they provide, essential information to programs about what is currently going on in the profession. And so programs can adapt and make changes to curriculum and things, based on their feedback from advisory boards.
Colin, any other additional feedback?
The only thing I would add is I think Caskey's similar to the way what Ben described. We do also have spots on our board that are meant for practitioners. They have to be filled by people who are actually currently working in the strength and conditioning field, so they can provide that feedback as well.
The next series of questions I think we're going to ask is to each of organization, of Katie, Caskey, and the COAS as well. So the first one's going to go to Katie first, and to Dr. Harrell. Can you provide us a brief history of Katie, including why it was founded and kind of the challenges of getting accreditation adopted by organizations?
Yes, thank you for that. The Katie didn't start out as the Katie. We began in 1991, very similar to what Ben was talking about, as another committee, an accreditation committee under what we call the Joint Review Committee of Athletic Training under CAHEP. The Commission on Accreditation of Allied Healthcare Programs. We partnered and stayed with CAHEP from 1991 till about 2006, where the JRCAT became independent from CAHEP, and that's when we changed our name to CATIE, the Commission on Accreditation of Athletic Training. This move was really made in line with similar to other medical professions who wanted their own freestanding body to allow for a little bit more autonomy and specific attention to the current trends in our profession that's pretty young and pretty evolving all the time. And so we changed to CATIE in 2006. And again, it really allowed us to pay specific attention to the needs of the athletic training profession. And so along with that, to answer the next part of your question, so what were our challenges early on? I think we became independent so we can have time to do all these very specific things and for athletic training. So the challenge now, well, what does that look like? What are the processes? What are the standards? And so I think a lot of our challenges early on were really about standards, about developing standards, about developing guidelines on governance and programmatic reviews and processes. And I think that took a while to get perfected, but things are always changing. Also, standardizing entry-level education requirements for athletic training, although that's not the sole responsibility of CATIE. As the profession changes and our scope of practice changes, how do we incorporate those changes into our standards and our processes? And so we work really closely with other athletic training partners that we call the Strategic Alliance to kind of help with some of those big decisions and big challenges. We've also had some evolution in athletic training where we changed the level at what our professional degree happens. So we used to have undergraduate programs, and actually we still do. 2022 was the last time an undergraduate program could accept athletic training students. We've now changed the professional level to the master's degree. And so as of probably 2026, all athletic training programs will be at the master's level. So you can imagine the changes and the processes that have had to be changed because of that major change to our profession.
You have challenges with, I guess in the inception, kind of very at the beginning of CATIE, it's just like, did you have challenges with faculty members or leaders that were thinking that it's just like, gosh, this is you're impeding on academic freedom, that we can just kind of, we want to be able to provide a uniqueness to our institution. Did you have to deal with that? I guess this is when CATIE's got started and kind of where it is today.
I think all accreditors do in one way or another. The way I like to explain it to faculty members or administrators when it happens, it's like the accrediting body is one there to help and to provide a foundation, and it's almost like I just moved into a townhouse recently, and when you go through the townhouse, they're all the same color. They look very similar. The roofs are the same. The structure and the foundation is the same. But when you open up the door, they all look very different. We all design them different. We have different tastes, different ways of doing things. And I think accreditation could be looked very similar to that. We're here to provide structure, foundation, and ensure the quality. But how a program operates and moving from that process-based to outcomes-based, it's kind of up to the program. So I really do think it was about educating our programs that just because we have these standards, we don't expect everyone to meet those standards in the same way. And so, yes, we did have some of those challenges, but I think over the years, as we became more transparent and have done more education, I think people are starting to recognize that.
So last question for you. Certainly there's other questions that will be coming up, but I mean, just one more question for you is thinking about Katie today, what unique challenges are you facing today? And what is Katie going to do to address those challenges?
I think that's a really good question. I think the biggest challenge we're facing today, we're currently in the middle of it, in the sense that we've moved from the undergraduate level to the professional level. We've seen a sharp decrease in the number of programs. And so looking at what does that look like in the future, making sure that the numbers of athletic trainers stays the same. That number hasn't decreased, by the way. The percentage of people practicing athletic training when they graduate has increased, so that our numbers are pretty much the same right now. But I think right now, just moving into this new level, I think that's one of the biggest challenges we're dealing with. I think the other answer to that question is I think we're dealing with a lot of the same challenges that everyone in higher education and healthcare are dealing with. So we're in the middle of strategic planning, looking at what some of those trends and things are. And I think that's the biggest thing about Katie. We're comprised of a lot of different professionals. We have people from different settings, people from outside member, physician members, people in practice. And I think you have all these great volunteers who come together, and we try to tackle and think of those challenges before they occur. And right now we're actually looking at what does the future of athletic training look like.
Wonderful. All right, we're going to change gears to CASKI. And so I guess the big question is, why was CASKI formed and why now?
Yeah, well, I think, in 2015, 2016, there was lots of conversations about the state of education and strength conditioning. And I was actually happened to be sitting on the board of directors at that time, and we had a strategic planning a couple of days of strategic planning in Colorado Springs, and one of the things that came out of that was the move to looking at and moving towards accrediting programs. And so I think the why now is an elevation of the profession of strength conditioning. Again, I'll go back to Katie and what a great job that they have done, and we've really seen as our counterparts truly in practice. Strength coaches and athletic trainers work very closely together in practice, and we saw how what happened with athletic training as that went from what it was 20 years ago to being an AMA recognized medical profession, and so that's what we started doing. So we started investigating what it would take and what it would look like to start the CASKI.
So kind of following into that is, how does CASKI ensure that strength conditioning education programs are aligned to current industry practices?
Yeah, so we're very new. CASKI has been was only formed almost 5 years ago, and so as you can imagine, lots and lots of feedback from the profession through survey, through meetings, through webinars, through open calls to what the standards would look like. So we have been deeply embedded in that practice for the last 5-6 years, and ensuring that we set the standards that they represent what the expectation is for entry-level practitioners. And so I think our challenge, or maybe not a challenge, but something that we'll have to ensure moving forward, is that we continue to do that. But I would say that that has been a large part of what we've been doing for the last 5 years in creating the standards and creating the council.
I'm gonna go one more question for you, Colin.
Yeah.
And I think this is one of the ones that we hear from employers. It's just like, gosh, are your students work ready? What are those key competencies that CASKI really wants to emphasize for their students, especially entry-level students, as they're going through kind of like the didactic part and the practical application things that you're doing? What are those key competencies that the students need to have to be work ready?
Yeah, that's a great question. And I happen to be a product of a old internship athletic training program where I think I had to do 2,000 hours. I don't remember if I think that's what it was, in 20 years ago, 25 years ago now, I guess. And that was what was missing. One of the things that was missing, the didactic part was easier to accomplish than what was missing from programs largely, and that was that field experience part. And so as we got feedback on from practitioners on what expectations were in terms of program design, safety, of course, delivery of certain skill sets, how can we integrate that into an internship model where we know that students have to get that and have to be checked for their competency, and I keep saying that term, but as an entry-level practitioner. And so that, I think that's been the biggest thing that is kind of new to the process.
Wonderful. And now we're going to switch to CYS. So Ben, could you give us a snapshot of the CYS and how it's influenced exercise science education over the years?
Yeah, definitely. So growing is the snapshot that I can give you. So, even though the COAS has been around for, 10 plus years, when I first started, we had about 40 accredited programs. Currently, we're at 136 accredited programs. So 5 are personal fitness training, 107 exercise science, and 24 of the applied clinical exercise physiology program. So it's definitely increasing in size, and the speed at which it is increasing is great too. And I think a reason why we see that is programs are finally starting to see accreditation as a good thing and not like a bad thing or something they have to do. They see it as a mechanism toward kind of continual improvement of their program, assuring that they're really kind of serving their students and the public. They see it also as a way to kind of stay current with emerging needs of the industry, but also evaluate their program in a way that they really have always wanted to, but often kind of put it on the back burner just because of various other demands, in academics. And so accreditation really brings that to the front. So kind of think of like, you often don't really clean your house that well until you have a house guest. So it's kind of the same thing. So, but those accreditation requirements we have also really dictate that programs maintain standards. So there's self-reflection that they do annually through annual reports, and providing, continual feedback. So we have this feedback loop. So programs can assess and see what they're doing well and what they're not doing well, and if they, really need to do any type of improvement.
Okay. So the next question for you I have is kind of thinking about the process itself of becoming accredited. I guess it's like from your perspective, or from the CYS's perspective, what is the most common area where academics programs struggle during the during the accreditation process?
Yeah, it's often like taking that first step. I think, regardless of whether it's our accreditation or CASKI or CATIE, it can be a very daunting process. Having that initial self-study completed. So I think just taking that initial step, going from, this sounds like a really good idea, I think our program can do this, to actually going through and understanding what the process is and what all is involved in that process. So the COAS really does its best. I'm sure the other organizations do as well in providing support to programs, whether it's, they're interested in it or they're filling out annual reports all the way through going through continuing accreditation. So we really help programs. We're here to make them succeed. We're not here just like, oh no, we're something that, pie in the sky type of thing.
Great. So we're going to go back to the full panel, kind of thinking about kind of the future and the opportunities for collaboration. Looking ahead, do you see the role of programmatic accreditation evolving in the next 5 to 10 years? Like, how do you see it changing in the next 5 to 10 years with programmatic accreditation?
Well, since I'm unmuted, I'll just kind of continue. So I kind of see, programmatic accreditation as the norm moving forward. For such a long time, it's been not the norm because we're a voluntary accreditation. And so I think accreditation in our profession should be and will be the norm. And emerging accrediting bodies like us and CASCI should really take and follow the lead that we have from other of our seasoned accreditors like CATIE. And so, CASCI has taken that initial step, but really is to ensure that our profession is recognized as a true kind of allied health profession.
Colin and Keisha.
I would just add that I think programmatic accreditation in general should evolve just like the CATIE's done over a few years. And since that we talk about, and I was guilty of it myself at the beginning, talking about quality assurance so much. And then Ben hit on it on his last answer, when not only were we here for quality assurance, but we really are here, and all accreditors, I think, should evolve into being organizations that are really collaborative and really want to be a helpful organization. I've been involved with CATIE for almost 2 decades. You all were supposed to gasp and say I look too young for 2 decades, but for 2 decades. And over the time, I've been, what we used to call a site visitor, we now call a peer reviewer. I was a review committee member, commissioner, so forth and so on. But I wanted to bring that up because even changing our name from a site visitor, that sounded like we were really coming in to be the accreditation police, changing the name to peer reviewers really showed folks that we were coming in to be helpful. These were people who had the same goals as you to make the learning and student experience better. And we wanted to come in and to help and to provide support and to be collaborative. And so I hope that's where accreditation evolves in the future, to being more helpful and more collaborative.
Yeah, I don't have a lot to add other than to echo that. I currently, in my current role, supervise 7 different accredited programs and various accrediting bodies, and some of them are almost adversarial. And I know that not all of them clearly, but I know that as CASCI, we wanted to take the approach that has just been mentioned, and that is to partner with universities to help them. A lot of these programs, are in departments. If they're in exercise science departments that don't have COAS or have an athletic training program, they're completely unfamiliar with accreditation. Unless they're in a college of health sciences that has, other PTs, OTs, PAs, those kind of things. And so we really want to partner with them and help them to improve and the profession as a whole. And I think, like Ben too, I think once people are continuing to more and more realize the benefits of accreditation, it's not quite as scary as it feels, and it's an ally that you have outside of your institution that can help you get new faculty lines and get more dollars for things, and it's really a great asset. And I'm hopeful that the next 10 years sees that in exercise science become the norm.
Your thoughts, Ben? You're muted.
I agree. Yeah, no, I think I definitely agree with everything that's been said.
especially when you're looking at kind of like from the, I guess, the US reps perspective. I think it's just like how are exercise professionals an integral part of the kind of the health and well-being of patients and clients over kind of the continuum of care. I think that's where it's just like, I think one of them is just what are the unique qualities that you bring, and how did you get trained? Where did you get that experience, and how do you determine some sort of level of prominence of kind of like where are these individuals coming from? Where do they get? How do you assess competency, and how do you work together as a team? I think is an integral part of a lot of our advocacy and outreach efforts. So this is great to hear kind of cross collaboration, like not only within the exercise sciences, but across the aisle, especially with kind of healthcare teams. So the next question is just like, what advice would you give to institutions that are considering pursuing accreditation, but are not sure about the process or the benefits? That's open to anybody.
Yep, I'm unmuted again. So, all right, sorry. I would say, don't be afraid to ask questions. I think that's probably the biggest one, or ask for help. We want programs to succeed. We're not like Keisha said, we're not the accreditation police. So providing programs with information and help is, I think, one of the biggest things that we can do. So our previous executive director, Walt Thompson, and our current executive director, Gina Cortez Shipley, spend a lot of time with some programs, really kind of helping them understand the process and the importance of kind of pursuing that accreditation. So I think don't be afraid to ask questions and ask for help.
Other thoughts?
Yeah, I was going to say exactly what Ben said. Is I think especially if people are unfamiliar with accreditation and what it means, ask all the questions. That's what we're here for, and can really walk people through the steps and what it takes to get accredited. Ask other programs that are accredited. We try to help connect people. We have a program here that's accredited, and I'll have people call and say, how did you answer this? Or what form did you use to evaluate your sites? And I'm always appreciative of those questions, and encourage people just to ask all the questions.
Great. So now we're going to kind of pivot a little bit from the faculty side and the buy-in from faculty. Now we're going to switch to kind of like how does accreditation fit for the students, and kind of like what they're thinking about when they're choosing an institution. So do you have any advice on how students can best leverage their education from accredited programs when entering the workforce?
Yep, I think students, it's changed a little bit over the years. So I think students need to be a little bit more proactive, which can be hard for some students, but really kind of be strategic in their education, and understanding that going to an accredited program is kind of really an important kind of first step in reaching whatever their end kind of career is. So I think, as they determine what, specific experiences or knowledge that they need to have and thrive at each stage of their career can be really, really important. So kind of having that strategic, this is where I need to go, and then what I need to do to get there.
I think one of the big things that we've seen, at least from occupational credentialing outside of fitness, is the students, what we hear from both employers and credentialing bodies from employers, just like, gosh, we have difficulty helping students or like recent graduates to understand what a career pathway is. And we are kind of looking for, especially for young students, just once they graduate, it's just like, what is the actual next steps in terms of advancing in my career? And then being strategic about their education, about like, if I go back to school, what specifically am I using that to advance in my career? I think that's the things that we've heard from the institutions. And then the other one is just like, how are the universities supporting them through, whether it's the formalized educational track or through professional education. So that's, we've seen that from that side as well. I guess like the last one before we jump into the questions from the audience, and we've had a ton of great questions that came in through the audience, is how is using academic accreditation, programmatic accreditation used to attract students and build partners with kind of build connections with industry partners?
I would say from the Katie standpoint, I hope this is answering your question. We actually on our website have a searchable portal where students can go and they can search programs by state. They could actually do a search and find out what the program outcomes are. And so that not only helps us become a transparent organization, but really helps students as being good consumers. That information is public, so businesses and industry can do the same. And when you're really looking at the value added for an institution or why should I attend this institution, we make it very transparent for students to find that information. I hope that gets to a little bit of your question.
Oh, wow. Other thoughts? Okay. So there's actually a lot of questions that came in. So I'm going to truncate some of the questions that I have for here. And so maybe we can jump in to discuss, because I think there's a lot of just kind of information that we'd love to be able to kind of get your feedback while we're here. So the first one, I guess this one is directed to the COAS first, and then we'll kind of work our way down. For this one is for the COAS, the physician community of interest category. Can this be a physician assistant or nurse practitioner, or does it have to be an MD or DO? This is the question is specific to the community of interest categories for the advisory board.
Yeah, no, great question. The communities of interests are essentially kind of, I sometimes think of it as like who's the hiring authority or who is going to be, getting these exercise science students or, graduates. So, if programs see that, a lot of students are continuing on into post-secondary, whether it's athletic training or, physician assistant or something like that, having somebody that's representing those specific disciplines, I think is 100% okay and good to have on an advisory board.
Okay. Next question is, this is going to be, the next one's going to, I'm trying to combine both of these comments. So can you all speak to the benefit of a dual accreditation through CAHEP and CASCI? And so the further one is determining the accrediting body to go through, because we currently have students that take the CSES exam and the exercise physiologist exam, and now you feel like you have to choose between two different organizations. Are there any thoughts of combining or allowing students to graduate from an accredited program from either one and could sit for either of the exams? And so I'll leave that to Colin and Ben.
Yeah, no, I think, currently, and as it stands, we don't necessarily have that reciprocity between the two accrediting bodies. But I think, if anything, something that has come from kind of this discussion that I think everybody has hopefully seen is how everybody really needs to work together. It's not just like a one is better than kind of the other thing. So for me, and potentially taking off my COAS hat, if that's okay, as a faculty member, I would look and see what's going to be best for the student. If they are going strength and conditioning potentially with CASCI, right? Even though the COAS does have strength and conditioning sponsoring organizations. I think it's just up to the individual program.
Yeah, and I think we've got lots of questions similar to this about athletic training, as well as physical therapy. And so, if someone goes through a Katie before and becomes an athletic trainer, used to, they could also sit for the CSCS after 2030, they won't. And I think our position is that there's very specific requirements in each of those pathways. And so what we're doing is trying to work with programs to create degree pathways that it would allow to meet the requirements for both potentially accredited programs, rather than the accrediting bodies themselves finding some way to merge the two. But to be able to be a CSCS and be a physical therapist or an athletic trainer or an exercise physiologist to help academic institutions create programmatic pathways to do both.
Great. Next one's to internships. So that goes to all three. So all three organizations. What suggestions do you have for accommodating internships for programs of large number of students, but are at institutions of smaller populations, or there's fewer businesses that are available to host kind of interns? And just follow up. I think the other question is just like, how do you split it across different concentrations or tracks?
Yeah, I'll just say this. In working with all of our accredited programs, clinical sites, internship sites, whatever the nomenclature, field work sites, that's one of the biggest challenges for all programs. And quite honestly, is sometimes, lots of times, the limiting factor in the number of students that programs can accept and facilitate is how many clinical sites that they have. So I think that is and can be a challenge. And may in fact be a limiting factor in the number of students that someone can accept based on the number of internship sites that they have.
Yeah, and what I've seen with COE and a lot of our accredited programs, initially they may have a very few number of internship sites, but as they grow as a program and become more established, they make more connections within the community and outside the community to have more internship opportunities. I think also exercise science is a pretty broad field. And so where a student could potentially do an internship there's a lot more potential places that they could go than I think some people often think about.
I would agree. I would say with Katie, our internship, our clinical education hours are within our standards. And I think it is challenging at first, but over the last few or a couple of years or 2 decades, athletic training has changed in such that the patient population that we're working with expands, and that expands our clinical education sites and opportunities as well. And I think another thing is one of our standards discusses an emerging experience. And so being able to give students emerging experiences when they're not in the classroom for a couple of weeks or months or whatever that time frame is for your program has allowed our students to take clinical education opportunities outside of the state, outside of the city, and even outside of the country. And so as our standards have evolved and our requirements have evolved, it's actually opened up a lot of clinical education opportunities for our students.
Next question for you. I'm sure this is a common question that all three of you are gonna be familiar with this one. With the emergence of more and more online exercise science programs, how are accrediting bodies dealing with this growing model of education? And further, do accrediting bodies have concerns with these online programs?
Yeah, no, that's a great question. And I think currently the way that the COAS is looking at kind of online education is there still has to be a in-person component to that education where they can actually, in person do skills and learn skills. So for us, and I'm sure because we're a hands-on profession, whether it's a strength and conditioning coach or an athletic trainer, there are some things that just don't translate that well to learning over an online platform. So, that's why we require internship and require programs to demonstrate that they have in-person like labs and skills that they do.
I think that Katie's answer is simple. It's how are they meeting the standards, and can they meet the standards in those situations? And if they can, then going back to that being outcomes based, show us that it's working and show the outcomes based on your program. I think from a accrediting organization, as this happens more, we have to look at some of our processes and some of our standards as it relates to administration, like who houses the program, so forth and so on. And I think there's some challenges there, or maybe some standards that are are biased for in-person education and not online. So I think as we move through this, we'll reevaluate some things. But if people are able to use online or be innovative and do things differently and still meet the standards and still show great outcomes, there's nothing in our standards that say that they cannot, if that makes sense.
All other thoughts?
Yeah, I agree with both. I mean, if they can meet the standards, then they can be accredited. We've seen it now, not just in our professions, but physical therapy, occupational therapy, physician assistant, most of which do require some face-to-face, hands-on skill demonstration and competencies that way. But yeah, I mean, it is a growing model for sure.
I think one of the things is just like, I think for institutions to understand too, is just like, if you look from the National Board of Certification side, after COVID, those who were purely online did poorly on the National Board exams that are independent of the educational institution. And that was across the board from just outside of fitness. We had a deep discussion with our psychometrician, and across the board, those where they used to have online or in-person training, and those were suspended temporarily, did terribly on the National Board exams. And when the introduction back into the classrooms again, then you see a massive spike in pass rates again. So I'm sure, I think Katie's, I think with the BOC, I'm sure they saw the similar pass rate drops in pass rate as well. So that's the value of hands-on training. It's absolutely critical to success, at least in the National Board exams. The next question I have for you, and there's actually two more questions that are coming in. We talked about the benefits of each accrediting program, but what are the consequences or challenges that academic programs and students face if they don't get accredited with a respective program or commission?
Well, I mean, I don't. I mean, I think it depends on who the accrediting body is and what the standards are. There are some that, for example, you go through a candidacy phase and don't achieve accreditation until you have actual outcomes in those types of programs, which is not the way CASCI does it. But a student would obviously risk having to leave that institution if they didn't get accredited. And there has to be a plan in place for what would happen in those cases. But in CASCI's case, we don't have to have the outcomes up front. We have to have a plan. The programs have to have a plan for how they're going to achieve the outcomes.
Yeah, I think for the COA, potentially the only, well, maybe I should have thought of this a little bit more. Potentially the only issue that I could foresee with a student not graduating from an accredited exercise science program is there potentially some certification exams that they would not be eligible to take. And that's why, accreditation is important, is to kind of level what everybody is teaching their students. So that's the only thing I can think of.
Yeah, I think it's even simpler for us. So you have to graduate from a KD accredited program in order to sit for our board of certification exam. And going back to that transparency and the dashboard, students can look up programs and see their level of accreditation, and if they're on probation or in the progress or whatever status they may be in. And I think that's and programs are also required to have some of those outcomes right on their website. So I think that we do a good job of making that information available for students and helping them to understand what the implications of going to a program that's not accredited may mean for sitting for the boards.
All right, so I guess two more questions. I think this should be the final two questions, and then kind of parting thoughts. I think I'd love to have kind of what your thoughts are. I think one question, I'm going to augment the question a little bit, is how do you, I guess it's like from each of the organizations, how have, when you're thinking about the profession, developed a trust between the exercise profession and healthcare. So it's just like, how do you see kind of either accreditation as an integral part of developing trust with kind of your adjacent health occupations?
Yeah, so I think for the COA, I think that's kind of accreditation is really a critical piece as we, the COA, really continue securing recognition for exercise professionals that have, distinct roles in potentially medical health and fitness and sports performance. So, unlike Katie that has, required accreditation, ours is voluntary, just like CASKI. But having, similar processes and standards in place that parallel accreditors like CASKI or registered dietitians and things like that, I think is a way that we can kind of further our efforts in positioning, the well-qualified exercise professional to be on a healthcare team and be recognized actually by, others outside of the profession. And, it's really kind of that first step in this continuum of that goal. So where programmatic accreditation is the first step, professional certification or licensure is the second step, and then continuing competency is kind of what we've seen as kind of the model that is in healthcare. And so I think accreditation is really that first step for that.
Yeah, and I'll add, I think healthcare gets accreditation from physicians to nurses to PTs, OTs, counselors. They get accreditation. And so I think, again, following in the footsteps of Katie, what they have done is it brought another level of legitimacy to the profession because the healthcare world understands what it means and what it takes to be accredited. So.
Other thoughts, Keisha?
I would say ditto to all. Accreditation is the big one, and really making sure that we bring people in when we can, whether it's on an advisory committee or in the classroom to see what our students are doing and learning. But from an accreditation standpoint, I really do think it's having students in different fields, but having that stamp of accreditation, I think is the answer.
This is the final question before your parting thoughts. I know we have a couple other questions that are popping up, but it's just like we got to cut it off at some point. The question is just like, we have many students that are going through exercise science for the sole purpose of moving on to physician's assistant, physical therapy, occupational therapy, and athletic trainer programs. And the question is there an opportunity to get dual accredited? I think that's just narrowing down to the questions, just like, and I think the dual accreditation is talking about CASKI and the COAS.
Yes, we have right now our strength and conditioning pathway has 19 hours of electives that students can graduate, sit for the CSCS, use those elective spots to fill prereqs to get into. We have a student doing it right now, wanting to go to an athletic training program. We can fill those with the prereqs to go to PT school, physician assistant programs and such. So absolutely, that is what we're trying to do with our health science students, is if they want to have that extra credential, direct them through that pathway rather than what one might see as a more traditional pre-PT degree.
Yeah, same thing with the COAS, as long as programs meet and show that they're meeting all the standards for their accreditation, whatever extra portion of the student's education is left, they can use those credits to take prerequisites for post-professional programs. And that's what a lot of students do, is PT, PA, OT, AT, a lot of T's.
All right, so we're in the last minute. And so you all have about 15 to 20 seconds to come up with an answer. What's your final thought that you would want our attendees to leave with?
Don't be afraid of accreditation and do it.
Colin.
Yeah, I think he should say it. Accreditation is the big one. It's important. It gives the student a basic an understanding of what they're going to get when they graduate from an accredited program is going to be the very best education that they can.
Keisha, you're gonna send us off to the future. What are your thoughts?
All that pressure. I would say accreditation matters. And when you have accreditation, you could be sure that you're getting quality.
Nice job, everybody. Thank you again to our esteemed panelists, Keisha Harrell, Dr. Colin Wilburn, and Dr. Ben Thompson. If you have any questions, any additional questions, you can always send us questions through the usreps.org website. We'd love to answer those when we get that. And thank you again for your time today, panelists, and thank you for the time for those who attended today. Thank you so much. Take care.
Thank you.
Thank you.